According to a survey conducted by Mission Australia, nearly 30% of the students in Australia is having to deal with one or more mental health issues. And when we take a closer look into these factors contributing to the cause, we can see that an alarming number of 8% of the students are dealing with mental health issues related to the use of alcohol and illicit drugs. Another 10% of the students who are dealing with mental health issues related to the addiction of cigarettes and vapes. Reference from Mission Australia 2024. Looking at these statistics, we can see student mental health issue has emerged as a significant concern within contemporary education system, as increasing number of young people report experiencing anxiety, depression, and psychological distresses. Reference from Lawrence 2015. These mental health challenges are frequently linked to the use of harmful substances such as alcohol, tobacco, vapes, and illicit drugs, which students may adopt as a maladaptive coping mechanisms or under the influence of peer and social pressure. William and reference from White and Williams, 2016. The rising accessibility and social normalization of these substances among youth exacerbate the risk, contributing to the diminished academic engagement, behavioral issues, and long-term health consequences. A reference from Australian Institute of Health and Welfare, 2021. Tackling this complex social and educational issue requires more than isolated efforts. It demands robust collaboration between the education and legislative systems. By integrating school based health education, policy enforcement, and mental health support services, and legal regulations. These intersectoral networks can create protective environments that promote well-being and reduce substance misuse among students. Reference from Torborough 2019. Such a comprehensive multi-level response is essential for addressing the underlying drivers of substance abuse and supporting healthier trajectories for young people and students. The increasing prevalence of alcohol, cigarettes, and drug use among students poses a significant public health issue and educational concern in Australia and globally. To effectively respond to this issue, there has been a growing recognition to the need for collective networks and integrate legislative structure and educational systems. These partnerships are instrumental in formulating and implementing policies, delivering preventive educational and fostering safe environments for young people. I would like to explore the partnership networks operating across the legislative and educational systems in Australia that aim to reduce substance consumption among students, and to discuss the roles of national and state level government bodies, schools, law enforcement, and non governmental organizations and community services, highlighting their interconnection, interconnected efforts in prevention and education, and importantly, intervention. So, the legislative partnerships for substance use prevention, uh, the the legislative framework in Australia provides the foundation for regulation and the access to alcohol, tobacco, and illicit drug among minors. At the federal level, the Department of Health and Aged Care oversees the implementation of the National Drug Strategy from 2017 to 2026, which is a national policy framework that promotes harm minimalization through prevention and early intervention and treatment. Reference from Department of Health 2017. The Australian National Advisory Council on Alcohol and Drugs supports the government in developing evidence based policies and strategies targeting youth substance use. The state and territory governments are primarily responsible for enforcing legislation related to alcohol and drug possession in school zones, age restrictions, and public consumption. They also implement education focus initiatives such as school drug education and road aware. So there are in Western Australia, which partners with the Department of Education, Law Enforcement, and Road Safety Authorization to deliver integrated health and safety programs to students. Reference from Government of Western Australia 2021. And the law enforcement agencies play a critical role in legislative partnerships by supporting preventive uh, prevention through school-based policies, um, and drug diversion initiatives. And these programs are often collaborative with educational institutions to offer early intervention services rather than punitive measures at risk at risk youth. Pardon my friends. Reference from Lee 2016. So coming to the educational system partnerships and curriculum integration. Uh, in the educational sphere, schools are the center of substance use prevention, not only through policy enforcement, but also via curriculum integration and pastoral care. The Australian curriculum, health and physical education, includes specific learning outcomes related to drug education, equipping students with the knowledge, attitude, and skills necessary to make informed decisions. Reference from Akara 2022. Educational authorities are all also educational authorities also work with public health bodies and NGOs to provide additional support and services. And non-government organizations such as Life Education Australia delivers age-appropriate school-based education on health and well-being, including the consequences of substance abuse. Their widely recognized mascot, Healthy Herald, is an iconic part of the drug education for many Australian children. Likewise, Headspace, Reach Out, and Beyond Blue collaboration with schools to supply students mental health and substance related challenges, offering counselings and online resources. Reference from Record 2015. And community health organizations and local councils extend their efforts by offering youth focused outreach programs, mobile clinics, and forums in collaboration with schools. These programs are tailored to a specific need of regional and urban communities, contributing to a broader ecosystem of support. Tombrew 2019. And coming to the joint legislative education collaborations, the key partnerships exist in the interface of legislative and educational sectors, and designed to streamline resources and provide a unified front in drug prevention. The Positive Choice Portal, for instance, is a federal initiative founded by the Department of Health and Development without input from educators, researchers, and parents, and it offers an evidence based drug education resources aligned with the Australian curriculum, supporting both teachers and students in making informed health choices. Reference from Newton 2016. Similarly, the Good Sports program, managed by the Alcohol and Drug Foundation, partners with local schools and sports clubs to challenge and change community norms around alcohol consumption, particularly in youth sporting environment. Um, Reference from Alcohol and Drug Foundation 2020. These initiatives exemplify the benefits of collaborative cross-sectoral networks in fostering protective environments and giving a ray of hope and support to the otherwise neglected youth. Coming to the end, I would like to talk about the strengths and limitations of current partnership networks, starting with the strength of these partnership networks, which lies in the multi level integration approach that combines education, policy enforcement, and public health. Uh, Programs such as STERA, short for School Drug Education and Role Aware, and public choices are grounded in research and aim to engage students, families, and educators collectively. However, challenges remain as implementation and action to programs vary significantly across state, and long-term evaluations of of their impact on student behavior are limited. Reference from Midford 2010. Coordination between schools and external agencies can also be inconsistent, especially in resource limited settings, which is an important concern. And addressing the consumption of alcohol, cigarettes, and drugs among students requires a comprehensive, coordinated, and continuous effort across legislative and educational system in Australia. And in Australia, a range of uh, partnerships have emerged to support policy development, curriculum integration, and early intervention. By working together, government departments, law enforcement, and educators, health services, and NGOs create an ecosystem that promotes prevention, supports recovery, and encourages responsible decision making among students. However, ongoing evaluation, sustained funding, and enhanced coordination are essential to ensure the effectiveness and equity of these partnerships. As the social and technological landscapes evolve, these networks must adapt to meet emerging challenges in youth substance use prevention. And I would like to end this podcast by quoting a powerful statement. The youth of today are the leaders of tomorrow, and investing in their well being is investing in the future of our nation. Nelson Mandela, 2003.